guys, you're welcome to the part 2 of preventing diabetes. Preventing part 2 of diabetes. But before I proceed, have you subscribed to my YouTube channel? Please go to YouTube, like, share, turn on the post notifications so you can get notified immediately I drop new video. And I always tell you guys, prevention is better than cure. So prevent, learn, act on it so you can live a healthy lifestyle. Okay, so now I just did part 1. If you haven't watched it, please watch it before you watch this one on how to prevent diabetes. And it's all about education. As a nurse, that's the only thing we can do to educate our patient and also people out there on how to live healthy lifestyle. So before the video ends, I was talking about healthy diet. This is where we need to take really good care of ourselves on what we put in our mouth. Eat healthy. There are so many things out there that we can substitute that can eat healthy. You don't have to break the bank to eat healthy, even though sometimes healthy lifestyle is very, very expensive. But do it in how your capacity or your money can buy. There are some things that we can substitute. I was talking about substituting white rice to brown rice, how we can substitute fried foods to baked food or air fry, then drink a lot of water. Very important to flush our system and also make us hydrated. We can also avoid junk food. Junk food means unhealthy food. So diabetes food, healthy food is very, very important because if not, this is, people who already have diabetes, they do carb count. They call it calorie count, because some of them are on insulin, some of them are on medication. They check their blood sugar very, very well. They check it before they eat in the morning, afternoon, night, at bedtime, and 2 a.m. just to make sure, because 2 a.m. they in the morning, midnight, in the morning, their blood sugar tend to drop, so they want to check it and they give themselves insulin medication. But what can we do before we get to that stage? That's what we are talking about right now. So let's eat healthy. Very important. Let's eat. If you need additional information on how to eat healthy, you can check with your healthcare provider, or also check online. Do your research or ask people like us. If you have nurses in your family or nurses around you, ask that what kind of food can I eat, or also a nutritionist. They will be able to help you out with that. Number 2, I was talking about exercise. We need to exercise. Regular exercise, we have to. It's a must. Exercise prevents a lot of this disease process. You don't have to go to the gym if you don't have the money to go to the gym. You can walk around your neighborhood. You can be active. Inactive is what we don't want to encourage, but active, you can do like 10 minutes 3 times a day exercise, or 3 times a week 10 minutes exercise. That should be fine. So let's do that. Move around. Let's be active. Number 3, let's avoid smoking and alcohol consumption. If you have to do those things, do it in moderation. But remember, even in the label, when you smoke, they say smokers are liable to die young. So the choice is yours. Whatever you want to take, you want to avoid all those things or continue to do it and cut your life short. The choice is yours. Whatever choice we do in our life to live healthy, it all depends on us. So avoid smoking and alcohol consumption. Number 4, maintaining normal body weight. That's why we have to exercise. We have to maintain ideal body weight. If you don't know your ideal body weight, check with your healthcare provider. They can measure your weight and your height to tell you if you are within or above or under your body mass. So it's very important. We have to know. That's why I did a video. I would re-emphasize it about yearly physical examination with our healthcare provider. So that way we can know if we are overweight or underweight or within our body max. Then number 5, regular screening, which I already talked about. Sticking our yearly physical, and also consulting with our healthcare provider on our lab results, because they will conduct a lab result, and those lab results we identify earlier if we have pre-diabetes or if we already have diabetes, so they can work with us and see how they can control and manage the disease process. Number 6, which is the last one, medication. I'm not going to talk about medication because the medication is wild. If I have to talk about it, it's big. And like I said in my program, I'm a nurse. I am not a doctor. So talking about medication, it have to do, is a big one. Insulin. Yeah, insulin, or you get your medication, which is the oral medication that they usually prescribe. We have a lot of them. So, but before we get to that state, that's why we are talking about all this prevention, so you can prevent yourself, so we don't even have to get to the stage of you doing insulin or medication, because it can be time consuming, because this is where you you do your calorie, like the carb count, and then you give yourself insulin based on your carb count. That's a lot. You don't want to go through that. You inject yourself yearly, frequently after checking your blood sugar. But please, before we even get to that stage, let us prevent ourselves. Eating right, exercise, consulting with our healthcare provider on yearly physical, so they can check if we are pre-diabetes or if we already have diabetes, what we can do to prevent it, eating healthy, exercise, avoiding smoke and alcohol consumption, and controlling our blood sugar, our blood pressure is very, very important. And also knowing signs and symptoms of diabetes. Once you know it, once you know about the disease process, the signs and symptoms, you can catch it earlier and you can prevent it before you get into complication. Because this is it. If you don't control your blood sugar and you end up having diabetes, and you're not even controlling the diabetes, you can have severe consequence. One of the severe consequences, most patients, they get blind. Some of them have healing wounds that don't even heal because their body system is damaged. It does not even heal. And some of them can even lose some part of their body, because think about it, if you have sore most of the time in their leg, and they hit it on something, they don't feel it because they have neuropathy. Things like that, you want to prevent it. That's why you just want to prevent it. Please stick it. And each time I post a video, I always post a write-up, or also some information that I know you can go back and check on it. Okay, now before I go, normal blood sugar level should be between, some people say 60 to 110, some say 70 to 110. Please, if you have below 70, please check your blood sugar frequently, because you don't want to have hypoglycemia. That's low blood sugar. When you have above 110, you don't want to have hyper. Think about it. Hyper, high blood sugar. Hypo, low blood sugar. You don't want to have it. Both two, you want to control it within that range of 70 to 110 according to CDC. Okay, I hope all this have helped. Subscribe to my YouTube channel, Health Talk Queen 1, Health Talk Queen 1, till I see you in my next health talk topic, which we don't know yet. Remain blessed and live healthy lifestyle and diabetes free. Till then, bye bye. Enjoy your day and have a wonderful day.